join us today. Thanks so much for recording today's session and joining today. We're so excited to share the 3 keys to cross-sector age-friendly care framework with you all. It helps to align age-friendly public health and healthcare across sectors to improve the health of older adults. And this webinar is co-hosted by Trust for America's Health and the Institute for Healthcare Improvement. With all that's going on in the world, we really appreciate folks taking the time to join us today. And when there's a lot of darkness around, this work really brings me a lot of light and hope. So really appreciate everyone joining with us today. Next slide, please. And while we'll be sharing a lot of information today, we'll encourage active participation from folks during this webinar, and especially during the discussion towards the end. You can always chat to the meeting group chat to share a comment or a question with the whole group and with the space. Or if you have a technical question, an issue, you can always chat to any of the hosts and Karan Phillips, especially, as well as Megan and myself. And if you want to raise your hand along the way, please feel free to do so as well. If you have any thoughts to add, we really want this to be a dynamic session. And if you jump to the next slide, to understand and to practice what we just talked about, we would love for folks to share in the chat your name, your organization, the sector you represent, and why does cross-sector care coordination and collaboration matter to you in your work? That could be personal, professional, or both. If you want to add where you are on the map, you can do that as well, or share your geography so we can also understand the geographic landscape of folks in today's meeting. So we'll just pause for a moment or so here to share, for folks to share your name, your organization, your sector, as I see folks are continuing to join, and why does this work matter to you? Welcome, Amy. Welcome, Viviana. And as you're sharing, or after you've shared a little bit about yourself in the chat, also look through to see what matters to other folks in this space and what brings them to this work. It's nice to see some geographic representation, the West Coast, East Coast. Wonderful. Welcome, Sue, Yolanda, Morgan. I see a lot about silos and working together, and I think folks have come to the right place. And if you're just joining, we're pausing here to share introductions, your name, organization, the sector you represent, and why cross-sector matters to you. Welcome, Christy, Rosemary. Great. We'll continue to chat them in, your introductions and what brings you to this work, as well as your geographic location, if that is okay with you. And we can go to the next slide. So how we'll spend our time today, we're now in the introduction, welcome, and objectives part of the presentation. We'll soon shift to the development and application of the 3 keys. Then we'll have some time for discussion, questions, and feedback, because we really, while we love sharing about the 3 keys, we really want to hear from you and any questions and feedback that you have about this work. And then we will move to a close. Next slide, please. And with that, I'll hand it over to Megan.
Would help if I mute myself. Thank you, Laura. Welcome, everyone. So great to see some friends, people that we know, and lots of new folks as well. So really appreciate your being here today and looking forward to this discussion. Our objectives for today's session are to share with you the process and development of the Three Keys framework and our recommendations for implementation by the healthcare, public health, and aging services sectors, and then to hear your feedback on the materials, where you see your sector or organization within the change ideas that we'll present. And what are your thoughts about implementation? Would this add value to your work based on your own sector and your experiences and capacity? So next slide, please. So Laura and I and others have been working on this project since 2021. We just realized it's been a little over 2 years since we started this work together, started during the pandemic, which of course put a pause on a lot of different things, but we're so pleased to be able to share it with you and learn from you today. So, and you'll have our contact information as well at the end, so you'll feel free to reach out to us at any time. Next slide, please. So we're going to share with you how this project came to be, and then the development of the process and resources, and then some we'll be sharing on some of the implementation ideas. Next slide. So by now, I hope that most of you are familiar with IHI's age-friendly health systems and TFAH's age-friendly public health systems work. And if you are, you're familiar with this graphic that we show to demonstrate and really depict the shifting demographics in the US. Based on the personal experiences that we have with families and friends, we also know that the medical conditions that many of us and the older adults in our lives face become more complex as we age. Health systems are frequently unprepared for these complexities, and older adults may suffer a disproportionate amount of harm while in the care of the health system. As well, while the public health sector's focus on prevention has had a profound impact on longevity in the US, public health departments have not generally embraced efforts to improve the health and well-being of older adults. And I say generally because we have seen a lot of engagement, particularly during the pandemic, and since the pandemic has officially ended, that the attention to older adult health really has grown. The pandemic really was a catalyst for that work. But as we have conversations with folks around the country, there are still many, many state health departments, local health departments that have not engaged yet in this work in improving older adult health. So as these demographics continue to shift, it's crucial that public health prioritizes healthy aging as a core public health function, and that we equip our health systems with the tools they need to reliably provide evidence-based practices to every older adult at every care interaction. And we also want to be mindful of caregivers in this process and in the building of a seamless older adult care journey. Next slide, please. So as IHI and TFAH have worked over the last few years to think about how we address these needs, we realize that significant gaps exist, despite the advance of age-friendly initiatives in states and communities across the country. We like to view these initiatives as a whole ecosystem, including public health, healthcare, communities, academia, workplaces, and the list is growing. But each of these movements in many jurisdictions continues to operate in a silo. We wanted to learn how best to bridge the gaps that an older person may experience when they leave the health system to re-enter the community living, or to go to the home, or whatever those interactions are, wherever those gaps are. We wanted to identify bridges across the ecosystem. So we decided to propose the development of a model to address all of the social, economic, and environmental needs an older person may experience, including the needs of their care partners. Next slide, please. So although our project focused specifically on the healthcare and public health sectors, we all acknowledge the historical and significant services that the aging and community services sectors provide in our communities. I'm certainly not an expert in the aging sector, but we wanted to be sure to recognize these important partners in our work. Aging services funding has a strong mandate through the Older Americans Act that provides funding for community-based services, but also is still limited in funding based on what Congress allocates, which is not enough to meet a community's needs across the board. We've recently learned that there are still wait lists in communities for meal services and other programs. We believe that the healthcare and public health sectors can continue to build partnerships with the aging services sector to improve awareness and collaboration to enhance the older adult care journey and to enhance advocacy for more funding across all sectors. Next slide, please. So the primary goal of this project was to design a system in which all older adults could age in optimal health in a setting aligned with his or her own wishes, which is both supportive and equitable. Our secondary aim was to identify strategies to align the age-friendly health systems and age-friendly public health systems movements in a way that provides really concrete recommendations for all stakeholders at all levels. As I said earlier, we started these conversations in 2021 and just completed the project earlier this year. Next slide. For level setting, both the age-friendly health systems and age-friendly public health systems movements each have their own framework that we try to employ to guide our work. This that you see on this slide, this is the age-friendly public health system, or APHIS framework, which has 6 tenets, as we like to call them, the 6 C's for transforming a public health system into an age-friendly one. The 6 C's are not prescriptive, but intended to categorize the roles of a public health department as it seeks to prioritize older adult health and well-being. So the 6 C's are creating and leading policy systems and environmental changes, connecting and convening multi-sector stakeholders, and you'll begin to see some of these same concepts within the change ideas that we'll present in just a little bit. So the third C is coordinating existing supports and services, then collecting, analyzing, and translating relevant data and sharing it with partners, communicating about important public health information, and finally complementing existing health promoting programs. So I'm going to turn back to Laura now for the next set of slides.
Thanks, Megan. You go to the next slide. Age-Friendly Health Systems is an initiative of the Johnny Hartford Foundation and the Institute for Healthcare Improvement in partnership with the American Hospital Association and the Catholic Health Association of the United States. The Age-Friendly Health Systems movement aims to follow an essential set of evidence-based practices known as the 4 M's, and what you can see here on this slide causes no harm and aligns with what matters to the older adult and their caregivers. The 4 M's are what matters: mobility, mentation, and medication. What matters knows and aligns care with each older adult's specific health outcome goals and care preferences, including but not limited to end-of-life care and across settings of care. Medication means that if medication is necessary, using age-friendly medication that does not interfere with what matters. And mentation prevents, identifies, treats, and manages dementia, depression, and delirium across settings of care. And mobility ensures that older adults move safely every day to maintain function and do what matters. Becoming age-friendly entails that reliably providing the evidence-based practices of high-quality care, known as the 4 M's. And IHI has currently recognized more than 3,000 age-friendly health system participants, with 2,000 of those counting the number of older adults reached with 4 M's care. Overall, the age-friendly health systems movement has reached more than 2.7 older adults in 8 countries globally, and we use a few spread mechanisms to ensure that health systems are reliably providing the 4 M's and implementing them in their care locations. And right now, IHI currently recognizes hospitals, nursing homes, ambulatory practices, and convenient care clinics as age-friendly health systems. If you go to the next slide, please. These are the organizations who worked in partnership to develop the 3 Keys framework. The partners included the Institute for Healthcare Improvement, the Michigan Health and Hospital Association, and Trust for America's Health. We couldn't do this work without our funder and collaborative partner, the Michigan Health Endowment Fund, who graciously funded this work. And we're really excited to continue this work and share it and disseminate it broadly, as you can see here today. Next slide. So to dig deep into the process of developing the 3 keys, we started first with a stakeholder interview process with organizational leaders across sectors. And from January to March 2022, the project team spoke with local stakeholders in Michigan to understand and identify gaps in resources, care, and systems to improve the health of older adults in Michigan. The 13 organizational stakeholders interviewed represented the following sectors: academia, advocacy, public health, healthcare, and government. The stakeholder interviews aimed to support our understanding of the current system, and we asked questions to understand, based on their setting, what barriers and root causes prevented older adults from accessing the resources that they need to live a healthy life, and recommendations for a better cross-sector care continuum to improve the health of older adults. You can see on this slide a standard interview template our team developed to design and collect the qualitative feedback that we received during the interview process, and then organize that data and findings that we'll share a little bit later. Next slide, please. We also wanted to understand the experiences of older adults and caregivers, as they are central to this work, and really those who are receiving services and who are experiencing inequities based on the system potentially. And it's always in our work needing to integrate those most effective in the design of a better system. So from February to July 2022, our team spoke with older adults to understand and identify gaps in resources, care, and systems, similarly that we did with the organizational leaders on the previous slide. We also asked about their experiences as both receivers of services and as caregivers. As we were digging into the conversations, found that many of the older adults we spoke to were caregivers themselves of older adults, either currently or previously. And so we interviewed 15 older adults, represented a diverse set of geographies, socioeconomic levels, racial backgrounds, health conditions, and familial supports to really make sure that we were getting the experiences of the older adults that make up Michigan, so that was reflective in the demographics of who we were speaking to. So we needed to ensure that our outreach process was equitable in both process and the content that we were leading within the interviews, and learned a lot along the way. Next slide, please. So from both sets of interviews, after going through reviewing the qualitative findings, a few set of themes and learnings emerged. And you can see here how we organized them by both the older adult caregiver interviews, the organizational leader stakeholder interviews, and what themes emerged from both. And a lot of really rich data came from the qualitative interviews that really drove the creation of the framework itself. And if you click one more time, we can see how we use that data to develop the implementation guide, a workbook that pairs actionable steps with the implementation guide, and a set of tools with a driver diagram and care journey maps. And within these themes, we know that it's not exhaustive. There are probably other factors that are affecting older adults and caregivers, but this is what we found through the interviews that we led, and as well as looking at the landscape in Michigan and across the nation. So we really wanted to harvest what we learned from the interviews themselves and elsewhere to collate these themes that compiled and really drove the creation of the implementation guide in subsequent resources. And we know that these themes do not operate in silos, and that they're really systemic and deep factors that affect the health and care of older adults and caregivers. Next slide, please. And so from there, we created the framework, the 3 keys to cross-sector age-friendly care, implementation guide, and workbook. And I just chatted in one of our links to that framework if you haven't accessed it yet. And the guide really helps us answer the question, how can public health and healthcare sectors each contribute to an age-friendly ecosystem? Understanding that there are more sectors involved in the ecosystem, we were testing what it looks like to put two together in practice and for those delivering and operating within those systems. And the components were developed to help healthcare and public health systems and leaders accelerate improvements across the care continuum. We know that there's a lot of work and a lot of frameworks already out there to help cross-sector collaboration, but we wanted to ensure that this was different and accelerating that process with actionable tools and steps to help folks get there, help cross-sector improvement teams really make actionable improvements within the systems that they're working in. And so you might be wondering, what are the three keys? That sounds kind of cool. And the three keys are part of our driver diagram and framework that are what matters, supportive system factors, and supportive financial structures and policy landscape. And these three keys really take a socio-ecological approach. What matters looks at the individual, the caregiver, that level, starting rings out in a way. The system factors look at that system and organizational level, and finally the macro environment with supportive financial structures and policy landscape. Understanding that we need to work at all three of these levels to really make improvements on the system that and all of the factors and the root causes that affect older adults' health. Next slide, please. So the three keys have 4 parts, and then an implementation guide, a workbook, driver diagram, and care journey maps. And we'll be walking through each of these different components to dig a little bit deeper into what they are and how to use them. And our intended audience is any public health, healthcare, aging service, or community-based organization and leader or champion wanting to improve care across the care continuum. And we have in the workbook especially, a lot of steps to help teams get there. Next slide, please. And I'll hand it over to Megan to talk a little bit about our equity considerations.
Great, thank you, Laura. So we've heard Laura talk a lot about systems and systems change, and that's really what we're all about. And it's important that we know that when we're advancing systems change in a way that improves the lives of older adults, it is important to consider equity, right? It's foundational to the work of both age-friendly health systems and age-friendly public health systems. We both take a very strong foundational health equity approach. These systemic factors that affect older adult health are broad, they're complex, and many are interconnected. There's also been research that explores the cumulative impact of racism and poverty, which can be exacerbated over the life course, as disparities in health, wealth, and well-being can widen over time. Even relatively modest inequities in early life can be amplified, if not reversed, as one ages. So we asked whether older adults are considered and engaged in conversations about inequities in care. We asked about the historical relationship between a sector and the older adults in a traditionally marginalized population and how that relationship might affect their care. So as we work together to understand how to address these issues, and as you work on understanding how to address them in your communities, it's important to understand your community, particularly the inequities that exist, which community partners you can engage in systems change, and to identify the role of your organization in the change ideas. And we feel like both the healthcare and the public health systems are really endeavoring to do really good work in equity, starting with data collection, which is certainly one of our foundational components of our framework, and I know is also really important to the work of age-friendly health systems as well. I will turn it now back to Laura again.
Thanks, Megan. And if we go to the next slide, we'll start next with our driver diagram, and we'll pause here for just a moment because we know that there's a lot in here. And if you've used a driver diagram before, you may be familiar with the structure of an name statement, primary drivers, secondary drivers, and maybe not, but tertiary drivers, a third level. And not all driver diagrams include all 3 of these levels, but we found it really important important to integrate tertiary drivers because of how complex the system is we're working in, and really wanted to ensure that we were explicit about the components affecting the health of older adults and caregivers. And so we really wanted to ensure that it was as detailed as possible to capture that complexity. And so looking at first the AIM and primary drivers, as you can see, they are the 3 keys, and we've renamed them as keys in a way to ensure that the language is accessible across sectors, recognizing that drivers and AIM statements and a lot of this language is rooted in health systems or quality improvement, primarily in health systems. And so we wanted to ensure that the language is accessible across sectors as folks are working in communities and in cross-sector improvement teams potentially. So we labeled and renamed some of the language to ensure that accessibility was there. And so as we stated, the 3 keys are what matters, supportive system factors, and supportive financial structure and policy landscape. You can see the secondary components are tied to those primary drivers, with additional tertiary drivers to give even more, be even more explicit about the system that we're working in. And this is how our implementation guide is organized. It walks through each of our keys, the components, and tertiary drivers, giving even more detail to support folks in understanding what this could look like within your community or within your system, and provides change ideas, as Megan noted, and suggested measures, both process and outcome, for folks to use so that you don't have to start from scratch. You already have a place to begin when you're looking to improve parts of your system, and knowing that you're also an expert within that system. So what matters to you and your work can also be integrated into this framework. And so from here, we're going to go into change ideas and measures, but understanding that this driver diagram is our primary kind of organizational structure for how the implementation guide is structured, and the additional supports that we're going to be going through next. And you can also find this in the 3 keys to cross-sector framework on page 8 and page 43 in this full spread if you want to go deeper on your own and use it for the rest of the webinar as well. Next slide, please. So now we're going to dive into the change ideas, going through each of the keys and a component as an example. Because there are a lot of them, as you could see from the previous slide, we selected a few change ideas that we wanted to dive a little bit deeper into as an example. And you can also ask questions about any other ones that you have questions about or are interested in from the different keys and components. So this first one highlights culturally centered and equitable care, and you may be wondering what a change idea is. And it's really just a general notion or approach to change that's useful in developing specific ideas for improvement, and a catalyst to help accelerate improvement within a system or within an organization. And it's a term that we use in improvement science that helps to accelerate the adoption of change. And so you can see here around culturally centered and equitable care, we have 7 different change ideas that improvement teams across sectors and with additional partners from the community and aging services need to do across sectors to really accelerate the adoption of change. And so the first one is collect and publish data on health disparities and link to quality and outcome measures. The second is conduct anti-ageism trainings. The third is ensuring that all materials are provided in an older adult's primary language. 4 is ensuring that an in-person translation services are provided in an older adult and/or caregiver's primary language. 5th, ensuring that processes exist for response and reconciliation in an event of discriminatory treatment. 6th, providing implicit bias trainings for healthcare providers and staff and community service staff. And finally, 7th is stratifying health data by race and ethnicity, as well as other demographic factors relevant in your setting, such as religion, income, geography, any demographic factors that matter to you. And so what it would look like in practice is for public health leaders, healthcare leaders, and other partners, along with older adults themselves, to really dive into what it would look like to stratify health data by race and ethnicity across sectors. So ensuring that you're sharing data, ensuring that you have a system and processes in place, understanding what race and ethnicity characteristics you're going to be stratifying by. So looking at one of these to help drive your improvement project across sectors. And, you know, a lot of times we like to take on more is more, but here really less is more. And taking one of these change ideas to really help be the center and the star within an improvement project. And so any cross-sector improvement team can choose one of these many change ideas that are listed in the guide, and you can see more under the what matters key and primary driver starting on page 11 in your guide. Next slide, please. And we know that this is a lot of information, and especially in this section going through the framework and these change ideas. So if you have any questions or comments or thoughts, we really hope that folks can chat them in, raise your hand, share any feedback or questions that you have along the way. So the next key we're going through is supportive system factors, and we're looking at workforce. And so this, you can see here again, all of the change ideas are what public health and healthcare partners need to do together. And you'll see in the guide, there are some parts where it may be just public health or just healthcare partners who will be leading the work, but ensuring that they have public health, community-based partners, aging services at the table as well as part of this work, because no one sector can do this alone. And that's what we're talking about here with cross-sector collaboration and the 3 keys framework, ensuring that even if it's something that public health partners or healthcare partners need to be leading, all sectors need to be at the table to really ensure that we're looking across sectors and across the care continuum. So you can see here the list of 7, again, change ideas that we have. And I just wanted to highlight recruiting and retaining local staff to reflect the diversity and language needs of the community. And you can see that a lot of these change ideas from both this slide and the previous slide, this is now looking at the system level, but a lot of these components have equity integrated into them, even if equity isn't explicit. So ensuring that recruiting and retaining local staff reflect those who you're serving in your community or in your geography, or what part of the system you're looking to improve. So part of that would be understanding who are the older adults in our system and community, ensuring that you have that data and information is part of the process if you're addressing this change idea. Having local staff who are in the community be a part of your improvement team. Those who are providing direct care to older adults be a part of the work, really integrating those most affected and those who are leading the process or are leading parts of the system to really be at the table to help co-design a better system for everyone, and especially the health and care of older adults. So as you can see, there's a lot baked into these change ideas, and you can see more on supportive system factors within this key and this component, starting on page 15 in the guide. Next slide, please. We wanted to share another example in supportive system factors because there's so much richness, as you could see in the driver diagram, in this kind of system level alone. So we wanted to share another example of a component around collaboration and communication in this set of change ideas as well. And you can see that all of these change ideas look again across sectors, and that there are 5 of them listed here. We're going to dive into the number 2, partnering with aging services and community-based organizations to enhance or develop a trusted referral system that allows healthcare organizations to share data across sectors. So there's a lot in there. One is just partnering with community and aging services alone. So ensuring, as Megan shared earlier, the real importance of having community-based organizations and aging services at the table generally, and especially as leaders in this work. Putting together and sharing data across systems and across sectors can be challenging. And that's why both sectors need to be at the table leading together along with other partners and organizations who are deeply in this work. And so what does it mean to share that data and create a referral system that's one tested, that works, that older adults are able to know what's happening, to have effective communication, sharing data. There's a lot that would need to kind of unpack as part of this change idea that's really important to think about when we're communicating and collaborating across sectors. Megan, I wonder if there's anything else from your perspective in this change idea that would be helpful to share, because there's a lot baked into this one.
Yeah, there really is a lot. And I feel like something that you said earlier, Laura, was that we don't expect everyone to take on all of these change ideas, right? I think that's impossible. So Laura
Absolutely.
suggested, yeah, select one of these change ideas to begin to work on. So if you're thinking about number two, partnering with aging services or community-based organizations, the first step might be to do a kind of an analysis of who are the aging services and CBOs in your community so that you can begin to communicate with them, you can begin to meet with them, and talk to them about the importance of collaboration, of collective impact, right, across, and breaking down the silos between them. Maybe there's already a system in place that allows for referrals for that on a small scale, so maybe that can be scaled out. So really begin to look at who are the potential partners in your community, what are the systems already in place, and how can those be potentially enhanced and expanded.
Absolutely. Thanks, Megan.
Mm-hmm.
And parts of these change ideas, there may be, even if they're working across sectors, there may be times where public health needs to lead, or when healthcare needs to lead, or when community partners need to lead, and the other sectors are teammates in this work and have their own role to play. And so when we walk through the workbook, we'll talk a little bit about roles, the improvement steps needed to do this work, and how to accelerate change across the care continuum. And again, if you want to see more and learn more about the change ideas under this key, supportive system factors, you can check out starting on page 15 of the implementation guide.
And I might, before we move on to the next one, I might add another idea that we suggest, kind of a strategy, and that is to look at your community health assessment process or community health needs assessment. So both public health and healthcare conduct these assessments, and if sectors can join together to align these assessments, that's also another really good place to start.
Absolutely. That's a great vehicle for a lot of these change ideas and improvement work. So thank you for sharing that, Megan. All right, next slide, please. And then finally, looking at the third key, financial structure and policy landscape, we're looking at program funding. And you can see here an example of what I spoke to earlier around public health being the leader on this first one, identifying resources to help organizations navigate the complex funding landscape and relieve administrative burden. But understanding that doesn't mean that healthcare is exempt from that work. They need to be a player in this and at the table, along with other community-based partners in aging services, so that they are part of the system and integrated into the system, but ensuring that public health is leading the way as the lead in this change idea. And you can see the other two change ideas needed to really integrate across sectors, advocating for long-term or multi-year age-friendly collaboration across sectors to promote strategic alignment and funding sustainability that reaches the local level, and prioritizing funding to projects and programs that are multidisciplinary and will support collaboration between healthcare and public health entities. So no siloed funding here. And really kind of both of those across sectors speak to multidisciplinary across sectors, multi-year, so ensuring that there isn't kind of patchwork when it comes to funding that can really kind of sustain the work needed to make improvements, since we know that doesn't happen overnight. It takes time to really change the systems that we're working in. And so long-term and more multi-year funding is really necessary to ensure that that collaboration can happen, can be thoughtful in our approach, make sure and equity is integrated in both process and content, And that takes time. So these are some of the ways in which we can see program funding being more sustainable in the macro environment to help support the system and individual level changes needed to really ensure that the system is working for older adults and caregivers. And you
I
can
wanted to
see,
add wanted to add one more
yeah,
note, if I could, Laura. I know you've been doing
absolutely.
a lot of talking, so grab some water.
Thanks.
But I did want to mention that we're hoping that these change ideas will also trigger additional thoughts and strategies within your collaborations, within your partnerships. We know that the list that we have come up with is not exhaustive. These are the ones that we identified based on the gaps that existed, based on the interviews that were done. So, hopefully, if you're thinking about advocating for funding, like, who else does that work? Well, we know AARP does a lot of advocacy work, and maybe there's another coalition in your community that can advocate for funding if your organization, if you're a government and you can't necessarily advocate, but there are, partners that you can engage with that might be able to advocate for more funding. So, use these ideas, kind of think about them, and hopefully they'll trigger additional strategies that you can share with your partners.
Absolutely. Thank you for adding that, Megan. And we know that there are so many more ways in which you can improve the system. And as we've said, you are also the expert of your system. So knowing what you need to do to change that, what's in your purview of control, what partners are available, it's all localized. Even though this work was based in Michigan, it's meant to be a national framework for folks to use across the US and beyond. So really ensure that we're localizing the change ideas, measures, improvement ideas for the geography and community that you're working in, and you will know that as part of your work. You can read more about the change ideas under this key financial structure and policy landscape, starting on page 19 of the guide. Next slide, please. So along with the change ideas in the driver diagram, we also put together a set of process measures that we suggest teams use to make improvements on any of the change ideas and components of the system you're looking to improve. So all of our measures are organized by key and component. We won't go through all of these, but these are just ones that we suggest. And of course, if there are measures that matter to you and process measures that will work to improve the system that you're working in, or the change idea that you want to address, you're always welcome to measure any additional measures that matter. And so you can find a list of these measures both within the framework of the implementation guide and at the end of the framework itself as a full list, if you want to see them all side by side in the appendix as well. Next slide, please. And along that similar vein, in addition to process measures, we also have 2 outcome measures that we suggest all teams, regardless of the change idea, component, or key that you're working to improve, look at and address for the older adults in their community or system. So the first one is the percent of older adults who agree or strongly agree with the statement, "I get the care, supports, and services that I need and want when I need and want them," ensuring that older adults get and want what they need for the health and for their care. And the second is percentage of older adults who report being able to age in their desired setting. And of course, there are other outcome measures that matter to you. You're more than welcome to measure those as part of your work. These are just a catalyst for you and your improvement work, so you don't have to start from scratch. And next slide, please. With that, I'll hand it over to Megan to talk a little bit about policy.
Hey, thanks, Laura. So we didn't want to, end or wrap up this work without thinking about a call to action. It's really important for those of us who work in policy to think about what is that call to action. And so we really believe that collective and aligned improvements to this healthcare journey that we're talking about across the multiple sectors will not only improve the lives of older adults and their families and their caregivers, but will also be cost effective and could potentially reduce the burden on both the healthcare and the public health systems. And so, when we're thinking about building an advocacy package around kind of a call to action, cost effectiveness is a really good strategy and good argument to make. And healthy aging requires that all sectors do come together with an alignment in both vision and scope to support the health and well-being of all individuals. And we're talking about across the life course. But these policy changes are really important in order to support the kind of partnerships between public health, healthcare, and community-based stakeholders that are necessary to address the broader needs of the growing older adult population. These policies should include a focus on the social determinants of health, as well as preventive measures to improve the whole foundation for good health. Adoption and implementation of any of these change ideas included in the guide and the workbook will help move our system, both our health system, public health system, and healthcare system, toward systems that are higher quality, respectful, accessible, and fair. So, Laura, let's talk about how we can do that.
I love that. Thanks, Megan. Next slide, please. So along with the implementation guide, we wanted to ensure that we had a workbook for actionable steps, guidance, and tools to help cross-sector improvement teams or anyone looking to improve care across the cross-sector care continuum. And the workbook has these 6 steps that we'll walk through in just a moment. And this uses the workbook and the framework overall uses quality improvement steps to help really accelerate the adoption of change and to know and understand if what you're doing is leading to an improvement and ensuring that efficiency and quality is at the center of all of the work that we do. And so the first step is getting started, ensuring that organizations and leaders know about the age-friendly movement within their sector. So age-friendly public health systems, understand what it means to be an age-friendly public health system, what the 6 C's are, and the framework that you're working in, as well as for health systems to understand what it means to be an age-friendly health system participant, and vice versa. So if you're a healthcare organization, being familiar with the 6 C's is really important so that we build a shared language right from the get-go on what we're trying to improve and have knowledge of each other's sectors so that we're not starting from a blank state, and we can really understand and build on the work that's already happening potentially within your setting and outside of your setting. So that's getting started. Forming a cross-sector team is selecting either a population or an area of the system that you want to improve. And it may be hard to do that, but it's trying to understand and having some background knowledge going into your project about the system that you're working in or the geography that you're working in, and selecting an area to start with, because we really want to start small when we're testing change, and involving those with lived experience of that system, older adults and caregivers who've experienced that inequity really as part and core to the process. We also want to make sure that we're involving partners who work at the front lines of care, whether from the public health sector and the healthcare sector, to ensure that those folks are involved in this work as well. And of course, as always, that we've been reiterating today, ensuring that community-based organizations, aging services, AAAs, AARP, and others are core partners in this work as well. So the next step is understanding your current state. And that ensures that you know the older adults in your community or part of the system that you're working to improve. And similar to this project, leading qualitative interviews to understand the experiences of older adults and those system leaders that you're looking to integrate into your work, and using that data to inform the direction of your project. So understanding what that landscape looks like, and then also using the knowledge and resources of your own kind of internal team to say, what do you know system, and really making that implicit explicit as part of your work, and using the resources that you have to do that. Setting an aim ensures that you're all moving in the same direction as a team, focusing on one of the change ideas, a key or a component to really ensure, as we said, starting small and testing one change idea at a time to ensure that what you're doing is leading to an improvement. This also helps us really have the energy for the work that's happening. You can either build on what other work within your community or geography or system, or start from where you don't have any work going on. I think it really helps to inform the work by talking to older adults, to system leaders, and to really use some of the resources that we put together around our qualitative interviews as part of a really key part of understanding the landscape in your current state. Measuring improvement looks at measurement as a critical part of the process for testing and implementing changes, measures, and whether what your team is doing is leading to an improvement. And this could help to either spread changes, discard, or adapt what you're doing based on what your aim is and the direction that you're moving in. And finally, spreading and sustaining changes and improvements looks at spreading what you've learned, disseminating the knowledge gained, the data that you collected, sharing stories of the people, of the systems and the work that you're doing, as well as both stories of what's worked, but also what hasn't worked, and really ensuring that we're sharing both bright spots and fail forward moments to help others learn from the work that you're doing and what you've learned along the way. And as you can see, these 6 steps may look like they are chronological, and we know that these are really cyclical. So what you learn in step 3, understanding your current state, may inform who is on your team. So if you learn that housing is an issue for older adults, you may need to go back to some partners in the community and say, we're not experts in housing, but we want to improve care across sectors and need to bring in more folks to your work. When you're measuring improvements, you may learn something about your aim that may not be working, and you may need to adapt what you're doing or a change idea that you're trying to improve along the way. So you may learn something in the improvement process or measurement collection process that informs your aim and how you're working. So although these 6 steps look like they are, one after the other, you may need to kind of loop back to some of them along the way and really use the tools outlined in each of these 6 steps to help you get there, and may need different tools at different points in the journey. So there's always something to do, and it's much more cyclical than the static 6 steps look like on this slide. And next slide, please. And I wanted to show, building on the change ideas, the driver diagram, and now the steps in the workbook, we wanted to kind of walk through what this could look like for an improvement team to take on one of the change ideas and then use some of the tools that we talked about in the previous few slides. So looking at what matters, and if you click one more time, culturally centered and equitable care, we're looking at the first change idea, collecting and publishing data on health disparities and looking to quality and outcome measures, which could be part of your community health needs assessment that Megan was talking about earlier. So taking that change idea, unpacking it, seeing what work is already happening, whether there is a community health needs assessment in your community, kind of who the players are, ensuring that older adults and other community-based partners like AAAs, AARP, ensuring folks are at the table where you go to where those folks are and where the work is already happening, using some of the steps and tools in the workbook, and looking at some of the measures. So you can look at equity-focused questions on the HCAP survey as a process measure for your work, as well as additional outcome measures, ensuring that older adults strongly agree with the statement, I get the care, supports, and services that I need when I want them and need them, and using all of these 3 tools together to help really inform an equity-based approach and an implementation-based approach in your work for improving how you collect and publish data on health disparities. So that's what this could really look like when you unpack it in practice for an improvement team. Next slide, please. And so shifting now from our driver diagram, measures, change ideas, we wanted to share another resource that's kind of the last and final resource as part of our work, which we call our care journey maps. And these were derived directly from the older adult caregiver and organizational interviews that we led as well. And oftentimes journey mapping, sometimes referred to as patient journey mapping, involves the creation of a visual narrative depicting a multi-dimensional relationship between an individual and a service, usually in an acute event like going to the emergency room, or a broken leg, or a fall, when we think about the health and care of older adults. And the maps that we put together really center the experiences of older adults and caregivers and show the importance of acting on and addressing what matters to an older adult, and illustrate the complexity and impact of the current system. And so if you go to the next slide, excuse me. We put together, based on the experiences of the older adults and caregivers that we learned from, we put together 3 sets of care journey maps. And you can see some of the demographic experiences that represent each of the maps. And these are ones that mattered to us, and some of the important demographic features and qualifiers that really we wanted to ensure were front and center in our work across the board. So that was race, ethnicity, geography, health status, and age. And you can see that the experiences are very different between each of the care journey maps, and wanted to ensure a lot of diversity in the experiences of older adults, since there is so much differences of experiences that we learned from in the interview process. And so we're going to go through the first, an example of the first set of care journey maps, and we'll show you what that looks like on the next slide. So this is the persona slide that goes along with every care journey map set that we put together. It helps to really humanize the experience of the older adults and tells a story of who they are. So this first care journey map set is of an older adult, and you can see their demographic factors on the left-hand side, using first person to really kind of personify what the experience and who this person is before you look at the care journey maps. So you can see that this person says, I live in a rural community, identify as Latinx or Hispanic. I have diabetes and other chronic health conditions, and I am 75 years old. What matters to me is to live in my home with my family and caregivers nearby. And on the right-hand side, you can see a little bit about the older adult's caregiver, because we really wanted to show the importance of caregivers as part of this work, and that they're really core to the individual level, especially that first key around what matters. So what is important to this caregiver is that they say, I want my dad to be heard and seen by the healthcare system for his whole self.
And Laura, if I could just jump in here, I just
Yeah.
wanted to add that as we were creating these personas, so the pictures are not the pictures of the people we actually interviewed. They really are, they're personas with characteristics, but we really feel like each of the personas is really reflective of what people want and what people need. Because, I mean, every older person in my life wants to live in their home, with their family and their caregivers nearby. So we really feel like this is, although they're personas that are somewhat based on the interviews we did, they really are reflective of a majority of people, if you think about the people in your life and you think about the people in your communities that we serve. So I just wanted to add that little bit more of a humanization, because we really did spent a lot of time thinking about these personas and making sure that they were reflective of a general characteristics in the population.
Absolutely. And we didn't take one person's experience and share it broadly. We really took a collection of experiences and factors to really round out the experiences and to keep anonymity in the process of the older adults that we spoke to, and caregivers as well. So that's why we think about them at the community level rather than the individual level, which we often see with patient journey mapping or care journey mapping between a healthcare practitioner and an older adult, usually in an acute event rather than a preventative measure that we're thinking about here today. So if you go to the next slide, this is the current state view of this first care journey map set. And to orient you a little bit, you can see that the journey is really the squiggle in gray in the center, where you can see kind of current state listed. And each of the bubbles, the dark gray bubbles, around that experience are the system factors impeding the health and care of the older adult along the way. And each of the stops along the journey are different events that happen or could happen for an older adult. And you can see that the starting kind of event for this care journey map is a diabetic older adult goes to an emergency department after a diabetic episode. And what happens next in the system is around kind of the journey in the center. And part of our work in identifying these system factors is looking at what change ideas could help to improve the system. So if you look at the lack of specialists in a rural area, you can say, hey, that's happening in my community, and I want to do something about it. We know we need more specialists in rural geographies, and especially ones with a cultural relevancy of the older adults who are in our community. And so you can find change ideas to directly impact that system if that's something within your control and within your purview, within your geography and community. And so if you go to the next slide, with that in mind, we wanted to provide what a future state could look like if community health and cross-sector improvement teams took a look at what the current view was and used change ideas, measures, and the resources in the improvement guide to really improve the system and areas that affect older adults and caregivers in that system. So if we were to use this guide across geographies and communities, and what we hope for a better and future state to look like is in this version. And these tools can be used both the current state and future state in a number of ways. They can help to inspire you for your work. It could help you understand what is happening and affecting older adults in your community or elsewhere. And it can also be used as a one-on-one conversation if you are a practitioner in public health or healthcare, to talk with an older adult and say, are any of these factors affecting you and your health? Let's talk about it. And it can help to drive your improvement work by saying, hey, this care journey map is similar to what's happening in my geography. I think we can use this to drive our improvement work.
I also feel like this map could be used to develop partnerships, because I feel like if you could take this map to a meeting, a coalition meeting, or first meeting with a partner, and say, where do you see yourself on this map? If we work together, we can create this kind of a seamless care journey. So useful for advocacy.
100%. And if you want to create your own care journey maps for your work and your community, we also put together a set of steps that we went through to develop these for our work and this framework at the end of the guide in the appendix. So you have the tools and resources to help you in this process as well, if it's helpful for your improvement work. Next slide, please. And I should mention that you can find all 6 maps, the 3 sets, at the end in the appendix, if you want to take a look and dive a little bit deeper into the other 2 examples as well. And finally, while developing the 3 keys framework, we went through a validation process to really understand the experiences of older adult stakeholders and caregivers, and to ensure that we listened and got it right as we could the first time as part of this process. So we spoke to we brought back some of our interviewees and got their feedback either in person through a validation survey or one-on-one meetings or over email, to really ensure that we synthesized the information the first time correctly, to get additional feedback on the direction of the work, the drivers, the keys and components, and the change ideas as well. So we really wanted to integrate feedback into the process and use what matters as both the key and kind of an organizational principle in how we did the work and how we developed the framework, as well as integrating equity into the processing and content. So we were really excited to see some feedback in that process, that without any prompt, one of our participants shared our appreciation and attention to what matters without any prompt, and that they could see that consistently throughout our materials, and hope that you can see that too, because that's what really matters to us, is ensuring we're doing what matters to older adults and caregivers. And I think with that, Megan and I have done enough talking, and can think about jumping to our discussion and hearing from you. I don't know, Megan, if you wanted to share anything else before we do that.
Yeah, no, Karan, if you go ahead and jump to the next slide for our the prompts, the questions that we wanted to ask you. So as we're thinking about this framework and potentially evolving it, what the next iteration might look like, or what this might look like if we were able to pilot the framework in a community or more than one community. So as you're kind of thinking about that, is that something that interests you? So be thinking about that as well, and we might be reaching out to some of you, but we really want to get a sense from you all as to, can you see yourselves using this framework? Can you see yourselves developing a coalition, getting started, taking those first steps? And where do you see yourself, within that process? Is this something that you think you'd be able to lead? What partners would you need to think about? But so as we're kind of, as you're thinking about this, all these different questions that I've just posed, we really want to engage you in conversation about this. We really would like your feedback on the whole framework, and not just on the questions that we've posed here, but if you have other thoughts and other questions, we can leave these up, or we can take the slides down just so we can kind of see each other, and we'll just continue to remind you of what the questions are. Why don't we do that? Why don't we take the slides down at this point, so we can have that conversation and think about, and I have the questions over here on my other screen, so I can continue to pose them. But the first question that we have is, what additional gaps in older adult care are you aware of? Oh, thank you, Laura, for putting the questions in the chat. So they're there for all of us to see. But any other thoughts that you all might have about what we've shared today? You can either raise your hand virtually or go ahead and just come off of mute. We have that ability. You can just come off mute and ask your question or share your comments, any thoughts that you might have. I'm most interested in, is this something that you think would be really valuable to your work? Do you see yourselves identifying? Do you identify with any of these change ideas? Can you see yourselves using them?
Again, this is
Hi.
Viviana Criado. How are you?
Hello, thank you for joining us.
Yeah, Los Angeles Alliance for Community Health and Aging. I'm thinking that this model is perfect. We have been here, and I say we because both the Department of Public Health and the Department of Aging have collaborated with you in the past about one of the case studies, and you know that we have been working on this. So to see this to come to fruition is just amazing. And we love the opportunity to partner to implement the framework. Right now, we are looking at implementing a project that is doing almost the opposite of what the framework presents here. And that is an approach that uses community empowerment, community collaboration as a way to identify a specific issue and tackle that issue and inform the system. So this is a community-driven approach. Yeah. So I would like for you to discuss how within the framework we can start at the grassroots level and bring the system change.
Yeah, I thank you, Viviana. Yes, I I fondly recall our work with the Los Angeles Alliance for Community Health and Aging and the case study that we did. And so glad that you joined us today. And I think what you're talking, so what the framework does is kind of maybe a top-down approach, and you're talking about a bottom-up approach. And I think that the change ideas could be adopted either way. I mean, I see, if you have a community group that is already identifying some needs in the community, you could identify a couple of the change ideas, even if it's just starting to have conversations with the older people in your community about what they need, what matters to them. This is a great place to start. A great question to start with is beginning to work with them and finding out what matters to them. And if you then identify that what matters to them is having a provider that's closer to them, having a provider that has information about healthcare that's in a language that is that's their native language or something like that. That's a really good place to start to come together and begin to build a coalition around those changes. Laura, I don't know if you have additional thoughts.
Yeah, that's wonderful. I think it can be a top-down and a bottom-up approach. If there's a group of community members, anyone can be a leader. And I think I wasn't as explicit about that as I could have been in my part of the presentation. It could be this work could be led from a public health leader, a community leader, a healthcare leader, but ensuring that all sectors are at the table and finding that champion who is also interested, as Megan was saying, going where the will is and seeing, bringing that work to one healthcare leader or organization, and then seeing what work could kind of ripple from there. But I definitely think it could be a top-down and a bottom-up approach, and using the framework to do so.
Thank you.
And you could
I
even think
appreciate
about,
that.
you could even think about using the map, right?
Love it.
As a way.
Yeah,
As a way to
thinking
do
about
that.
that.
Yeah.
Even as a reporting
Mhm.
tool is amazing. The before and
Yeah.
after. Great tools. Thank you.
Yeah, thank you. Others have ideas of work that you're already doing that may align with the framework, or other ways that you might see the framework being implemented. Or what's missing? What have we missed?
Tell us.
Hi,
Kelly,
hi. It's
good to
great to
see
see
you.
you all. Yeah, it's good to see you. So I really like this model, and I greatly appreciate that the financial structure is mentioned within here. We've been working, at establishing a coalition and continue to add partners, but we kind of recently found that there were some issues with financing. For instance, for example, we had some wall bars that had been given to us from the Department of Health, but we didn't have money to finance the installation of those.
And
So
Kelly, why don't you share what organization you represent, your local health jurisdiction?
certainly, yes. I'm with Benton Franklin Health District, and that's in Washington.
Thank you.
And so, yes. And so what we've been able to do is kind of partner with some of the agencies that are within our coalition. Because we're a public health department, we're not allowed to, apply for funding as a nonprofit, but we were able to connect with the community health department, community health section of our local hospital, Cadlick, and their foundation, and they were able to apply for a local grant here. And so we were actually just awarded that this last month. It's a small amount of money, but it's a great start. And so we're hoping to continue to build, looking for funding. And so I was so kind of relieved to see that the funding component is included in this model, because I think it's a really important part. And we're just kind of getting started and working ways to address funding for many different issues here in our region.
Thank you, Kelly. I appreciate that validation. And what a great idea to partner with another organization that can reach out for funding and can apply for that kind of grant funding. So that's really important, a really important strategy. Thank you for sharing.
Thank you. Yeah, we actually ended up having 5 partners all included together that finally made it all happen. So it really does show that the age-friendly public health systems model of connecting all the partners together, that it really is what's needed. So thank you for
Yeah.
that.
Awesome. Thank you so much. Other interesting partnerships that you all are thinking you might be able to engage with, or you already have started engaging with, that might be interested in this framework? I know some of you have been doing this work for a while, and some of you are new to it. Just would appreciate hearing any thoughts. Viviana, you have additional thoughts? I see you've come off mute.
Yes, one of the things that would be helpful probably for all of us is to learn what would be the way to connect with you and maybe discuss the work that we're doing in a one-on-one and discuss possibility for technical assistance and collaboration. That's something that I'm very interested on.
Sure, I'm going to put my email address in the chat, and also my colleague Karan Phillips. And then, oops. And please feel free to reach out to us. And then Laura, if you want to do the same thing, and we can all get together on a call. You can reach out to us, Viviana. Happy to set something up and share any thoughts and ideas that we have, any strategies, and we can point to some examples and potential partners as well.
Beautiful. Thank you.
Thank you. Great. Thank you, Morgan. Appreciate that comment.
Is there anything in particular, Morgan, that you're excited about or that you think it will be useful to improve? If you're comfortable coming off mute and sharing a little bit more.
I think she may have just hopped off. Oh, no, there she is. Oh, her background noise. Okay.
Understandable. Thank you.
Yeah.
And of course, if you're in the process of sharing it with other health departments, don't hesitate to reach out to Megan or myself. We'd be more than happy to help.
Absolutely. And so we will share the slide deck and the recording of the session today with everyone who registered, whether whether you attended or not. So we definitely want to make sure that the resource gets out there, but we're also going to remain open to your feedback as you have a little bit more time to peruse the materials, to think about those change ideas. And you never know, we may reach out to you again for additional feedback on next iterations or ideas for next iterations. So we really appreciate you all being with us today, and the time that you've spent with us, your thoughtful comments and ideas. So please do continue to reach out to us. Any final thoughts from anyone? Laura?
No, just echoing what you shared, Megan, our appreciation for taking the time to join today. We know that we're approaching holiday season, so I know folks are probably so busy, and just really appreciate the time you took to join us and to hear a bit more about the work that we love to share. And it was just such a pleasure today.
Thank you for your time and for sharing your amazing work. Thank you so much.
Thank you. Thanks, everyone. Hope you have a wonderful holiday season.
You too. Bye-bye.
Thank you
Bye.
all.